seriously. And we have heard many hours of testimony, and we have worked very hard to incorporate those concerns. The people in Santa Cruz County have spoken very clearly about their support for compassionate use of medical cannabis. And the county has been a leader in the state and in the country about trying to think of creative ways to meet the needs of the community. Over the last 5 years, there's been a massive evolution of medical cannabis, and there's lots of different reasons for it. Santa Cruz County has probably always had some kind, or not always, but for many decades has had some kind of growing of this plant. But in the last 5 years, we've seen a real explosion of this in our county because of the fluid nature of the law and the way people perceive those laws in California and every other state in the country. And we are in this transition period, and I don't know how long this transition period lasts, but in a period of transition, there are going to be starts and failures and restarts and other changes during that time. When we have looked at an ordinance about managing cultivation in Santa Cruz County, we did that in a very public way, and those of you who've been regular attenders in our chambers have heard multiple proposals, hours of testimony, and real efforts of trying to roll up our shirt sleeves and come up with something that was smart, that was nuanced, that was effective. And after 11 months of having it had a lot of unintended consequences. We said that we cared, that we wanted to protect our neighborhoods, protect our environment, and ensure access to people here who have these recommendations from doctors to be able to get it. And what we've seen has not matched our goals. And maybe no one in this room is responsible for that. But there are lots of people who are responsible for that. And those impacts have been clear. When I hear from residents in Bonnie Doon, I take that very seriously because we were conscious of when we created these rules that you couldn't grow on parcels less than 5 acres. Most of the parcels in Bonnie Doon are not 5 acres. And yet the proliferation of commercial cultivation was extraordinary. So the nuance hasn't completely worked well. And so in December, our board, trying to figure out how to deal with the problems that it created, made some suggestions for our county council to come back with changes. We didn't do this in secret. We heard lots of testimony that day, and we've heard lots of testimony since then. So the idea that somehow this board isn't listening, or that hasn't listened to a variety of voices, or has listened to some voices greater than others, would be inaccurate. And we have a responsibility to meet all 3 of those goals, which is protecting our neighborhoods, protecting the environment, and ensuring access to people. So I appreciate that the sheriff, our CAO, our planning director, and like on our county council, we're moving in that direction. That is different than what people have experienced over the last 11 months. But it's important to remember that in this period of transition, there are going to be a lot of things that change. I've heard many times from people who said, we're willing to accept the risks. Well, one of the risks was that the rules would change until we find a way to do it right. So I support and would move the recommendations that was included in the letter from the sheriff, CAO, and planning director, and have that come back on March 24th. Again, more time for people, if they have an alternate regulatory scheme, now is the time to start actually putting thoughts on paper. It's not realistic to say that we have a better idea, try this. You're going to have to do a significant amount of work, and the policy work, that's what we do. We try things out, I did get a call this morning from Dave Van Lenne, who's president of the Farm Bureau, who I met with last year as part of a group that included WAM, that included members of the dispensary community, that included cultivators, to try to come up with the existing rules that we have now. And at that time, the Farm Bureau's primary interest was creating a third-party certification system. That's what they said that they wanted. And in our original rules, in our ordinance that's on the book now, we have some language in there about a third-party certification, but it's very ambiguous and has only been used in very rare circumstances. I think we owe it to patients to ensure that we have safety in the plants that they are receiving, that a certification program that can help us identify the biodiversity needs that are required for this community would be useful, that we could draw on expertise from the ag industry, the Farm Bureau, medical research community, and other experts to try to come up with a certification system. We are the home of the organic farming standards in this country. We know how to do this. So I want to just add one part to that motion, just to have council or the group that work with the Farm Bureau and others to see if there were outlines of a certification program that could come back that would be meaningful in terms of ensuring safety of patients and supporting the biodiversity, because I realize that's real, and that our proposal right now may not actually meet those needs effectively. But without anything else, this is the path that I would support. So I would support the actions of in that letter, and just add that the committee work with the Farm Bureau and other experts about a third-party certification.
Supervisor